This is a standard nasal mask and it's the most common type of mask that we use. This is because most people prefer to leave their mouth clear so they can take a sip of water in the night or talk. Even though most people with obstructive sleep apnea syndrome say they breathe through their mouth, provided you can breathe through your nose and you don't have any structural obstruction to your nose, such as a polyp or a deviated septum, you should be able to use a nasal mask. A nasal mask is also suitable unless you have very frequent nasal infections and colds which result in a blocked nose, or if you have very severe hay fever, this may not be the right mask for you. I'm going to put it on now, Amna, and you can help guide me if I get this wrong. So I think the easiest way to put it on and off is to unhook the mask. So I'm now going to just unhook the Velcro loop. I'm now going to put it on over my nose.
That's right. If you pull the back of the strap down to the base of your head. There we are. You'll know it's in the right position because you'll have a strap above and then a strap below your ear. Now you loop it over the hook. Make sure the straps aren't twisted and the mask is in the center of your face. Is that comfortable?
Yes.
Okay, you can now turn the machine on. Is the mask leaking?
There's the air coming through the air vent here.
But nothing blowing into your eyes or leaking underneath your nose. That's a good fit. If you need to wake up and go to the loo during the night or have a sip of water, in order to remove or detach yourself from the machine, if you stop the machine blowing and pinch the grey buttons on both sides of the elbow joint and release yourself from there, and when you come back, if you clip it back in, make sure it's in the right place and creating a seal, and then turn the machine back on to start the treatment.